November is National Diabetes Month, and while you may be familiar with the more common types of the disease, did you know that prediabetes is also a major health concern?
Well, according to the CDC, an estimated 84 million adults in the U.S. have prediabetes, and the majority of them don't know they have it. Family physician Dr. Caudle is here now to tell you if you may be at risk. Good morning, Dr. Jen.
Good morning, guys. How are you?
Good. So, Dr. Jen, I feel like we always hear about sugar, but what do we know about the causes of diabetes, and what about prediabetes?
Yeah, I think it's a great question because I think a lot of people don't actually know what diabetes is. There are many different types of diabetes. We're focusing mostly on type 2 diabetes, which is what affects many Americans and people throughout the world. But type 2 diabetes occurs when our bodies don't use insulin properly, and sometimes we don't make it properly as well. And as a result, there's too much sugar in the body that doesn't go into cells. It goes into the bloodstream and it can affect different organs like our heart, our eyes, our blood vessels, our nerves, etc. So that's the thing with that.
Well, I've never heard of prediabetes. So what are the symptoms and what are the risks?
And what is it? So prediabetes is that step right before diabetes. So your blood sugar is too high. It's not normal, but it's not high enough to be called diabetic. So prediabetes is that borderline phrase. And as we mentioned, 84 million people have it. 1 in 3 don't even know they have prediabetes. But this is really important because prediabetes is a risk factor for then getting diabetes. So it's really important for people to know.
And so how do you know if you're at risk? And if you are at risk, what do you do then?
Right. So a lot of the risk factors for prediabetes are the same as diabetes. It's being obese, being sedentary, not having an active lifestyle, eating a poor diet, age 45 and older. Women who've had gestational diabetes, that's diabetes during pregnancy, are at a higher risk. Certain races, African Americans, we're at higher risk, as well as other races as well. And so those are some risk factors.
Well, once you determine you're at risk, what do? Get a blood test?
Well, you got to go to see your doctor. That's where we come in. I want people to go see your doctor because really the only way to know, I mean, you might have signs and symptoms, but most people don't. You've got to see your doctor for blood tests. There are also other tests that can be done as well to see, are you in that pre-diabetic
part
range?
of your regular physical?
That's or like sometimes it may be outside the regular physical because we want other things to be checked too. Blood pressure, cholesterol, those can all kind of factor into this diabetes sphere.
Well, let's say you are diagnosed with diabetes. Are there any things that you can do to maybe reverse the diagnosis?
Yeah, so that's a great question. Once you're diagnosed with diabetes, we don't think of it as actually being reversed. We think of it as being controlled. So people can control their diabetes to the point where they're no longer on medicine, is no longer on insulin, they're doing well, but they still have to work to maintain it, keep a healthy diet and lifestyle.
Diet, working out, that sort of thing.
And you can delay diabetes and prediabetes, and I think that's really important as well.
Exercise too.
Exercise, which is good. Dr. Donovan, I love it. So things that you can do to prevent or delay diabetes: losing weight and keeping it off, exercising regularly. Jim, that's exactly right. Eating healthy, watching those carbs. We don't want to take in too much sugar. Quitting smoking, of course, your regular checkup so that we can test to see if you have diabetes or not. But of course, talking to your doctor is really important. So
good information. I'm paying more attention to my health every week that you're here. Thank you, Dr. Jen. We'll be right back.